get that going. And then I'll wait maybe one more minute just to let people join on if they're trying to get logged in. And then I'll do a quick introduction and we can kind of get started. Okay, I think we'll get started.
Are you the moderator, Pam?
I'm going to play the role of moderator today.
Okay.
As myself. So we'll get started. We are going to record the session and we'll post it on the health website. And then also we have a YouTube channel. The health department has a YouTube channel, so I'm going to be posting it on there as well. And we're going to try to upload the other virtual town halls we've done. I think this is number 3 or number 4. So we'll try to upload those. So in case anybody would like to go back and take a listen to anything, they certainly can. Quick introduction. My name is Pam Fender. I work in the environmental health program as an environmental health program manager. For all intent purposes of COVID response, I've been playing the role of public information officer, so assisting in getting some of those pieces of information out to community, to leadership, to employees, to health department staff. So that's kind of the role that I've been playing. Today, our topics for our virtual town hall include adolescent vaccine information, some new guidance on fully vaccinated individuals, some vaccine data specific to the Ho-Chunk Nation, some testing data specific to the Ho-Chunk Nation, and then we have a lovely group of panelists today that we're going to hear from. We have Dr. Amy Delong, who's going to be sharing some information on the adolescent vaccine. We have our executive director, Kiana Beaudin, who will be talking about some of the data pieces and the new guidance around for those fully vaccinated. And then we have our public health officer, Ronelle, joining us from the lovely area of Whitburg to talk a little bit about some of the data, hospitalization, and vaccine information that we have. So with that, I am going to turn it over to Dr. Delong to start off with adolescent vaccine. So I'm going to actually make you the host.
Okay. Good afternoon, everyone. Thanks for being here. I am going to talk more like what's been going on with the adolescent vaccine approved for children age 12 to 16 just on May 12th. And this is the Pfizer vaccine, not Moderna. 2 shots, 3 weeks apart. And I think in terms of encouraging our families, you know, again, as a physician, I would never encourage anyone to do something that I would not do. So I feel that enough studies, data collection have been done on this age group to the point where I had my own 17-year-olds vaccinated when it first came out. So I would just encourage those of you who have not had your adolescents vaccinated yet to please do so. It's an important step to getting back to normalcy, especially with groups and gatherings. And I think with the summer and last day of school here, anyway, being yesterday, especially important if you want your children to participate in summer sports, camps, that sort of thing, or even family gatherings to get them vaccinated. I do want to address some concerns, specifically about the myocarditis and pericarditis. There have been rare reports of these side effects from the Pfizer vaccine, um, actually with Moderna also. And and myocarditis is inflammation of your heart muscle. Pericarditis is inflammation of the lining of your heart. Um, when they've looked at studies, or that surveillance system for adverse events, most of these events have happened in adolescents, in males older than that were 16 or older, and typically after their second shot. Symptoms, if you're curious, are chest pain, shortness of breath, and a sort of like palpitations or fast beating of your heart, fluttering or pounding heart. Um, so those are the symptoms. The other agenda item that I've been asked to address is something called multi-system inflammatory syndrome in children. So as many of you know, when we look at the number of people who have been infected with COVID, more adults than children, right, have been infected by COVID. And most children, when they do get COVID-19, have mild or no symptoms. Basically, they are asymptomatic. However, there are those very, rare cases where children become severely ill, need to be hospitalized, and even die from this. And one of the effects that the children are dying from is this multi-system um, inflammatory syndrome. I had to look it up and find out exactly what it is. And what it is just like the name implies, it's inflammation of multiple organs. And I wrote them all down because it was almost every organ, but it's your heart, lungs, kidneys, brain, skin, eyes, or any of your gastrointestinal organs. We don't know what causes this syndrome. All we know is that some of the children who got COVID infection and became severely ill were found to have this syndrome. Again, most kids who got this syndrome did well. They did require medical care and got better with medical attention. So while there were those rare cases of children who died, most of them survive and live through this just fine. Symptoms of the multi-system inflammatory syndrome include fever, abdominal pain, vomiting, diarrhea, neck pain, rash. Remember, this is affecting multiple organs, rash, bloodshot eyes, and feeling extra tired. So, so lots of symptoms, and lots of symptoms that could point to other things. So I don't want to get anybody too worried about it. And emergency warning signs, so if these things happen, you should really go to the ED, are trouble breathing, chest pain that does not go away, confusion, they're less alert, they have pale skin or blue nails, and they have severe abdominal pain. So I did want to address, those two rare side effects, or the multi-syndrome inflammatory. I said the the inflammatory syndrome, is a side effect to the infection, whereas the myocarditis and the pericarditis are a rare side effect to the vaccine. So again, I think if there's an underlying message here, I do want to convey that the vaccine, the Pfizer vaccine for 12 and over children is safe and it's effective. It prevents children from getting severely ill and being hospitalized. It reduces the spread of COVID to other family members and friends, and it allows that quicker return to activities and gatherings that we all look forward to in the summertime. So again, I encourage everyone to vaccinate their children in that age group. We're hoping that the younger age group gets approved in the months to come. And if you have any questions, I'll do my best. Thank you.
Amy, it's my understanding that the myocarditis and pericarditis have not been proven to be a side effect of the vaccine at this time, and that it has occurred no more than normal in the general population, and that the notice was sent out so that providers could be on the lookout and consider COVID vaccine when a child or anybody presents with this. Is that your understanding as well?
Yeah, it is. And so thank you for making that point. Again, there is a vaccine adverse event reporting system. And basically, everyone is being encouraged to report any side effects. And so this, again, the myocarditis and pericarditis are being reported, but we don't know that it's caused by the vaccine. Thank you for that, bringing that up. And most kids, remember, with this, get better. You know, they don't die from it. They get better with rest and fluids. So another thing, like kids are resilient and bounce back from this, regardless of how they get it.
Okay, looks like I'm next, and I have new guidance for fully vaccinated individuals. So you can gather with others without wearing a mask. However, it is recommended that you continue to wear your mask and social distance. You can attend gatherings even with those people that you don't know their vaccine status. But again, it's still recommended that you wear your mask and practice social distancing and those kinds of things. And there are a lot of things opening up more, concerts and sporting events and all these kinds of fun things. In fact, I just came from the legislative meeting where we amended our masking policy so that patrons and guests of our enterprise facilities, which would include our casinos and gas stations, will not have to wear masks. However, employees will continue to have to wear masks at this time. So I know that that was a question that we had received about masking for casinos. Did I forget anything else about what fully vaccinated people can do? And just as a reminder, fully vaccinated definition is if you've received your second dose or your first dose of Johnson & Johnson, you have to be 2 weeks out from that dose to be considered fully vaccinated.
Repeat that again?
I'm sorry, can you repeat your question? Whoever's speaking, you're breaking up. Perhaps you could put it in the chat. Let me look in the chat. Masking is not needed for those vaccinated. That is correct. But it's still recommended. And fully vaccinated is 2 weeks after your final dose of Pfizer or Moderna, or 2 weeks after your only dose of Johnson & Johnson. They are telling us to prepare for a booster shot in the fall, and this, from my understanding, would be against the variants that are out there at this time. What precautions should people continue, both vaccinated and unvaccinated? So even though you can still go out without masking, it's still recommended that you mask, socially distance, and continue with your hand washing and hygiene and all of those good things. So thank you for your questions. So vaccine-specific data, we have, I'm going to try and share my screen. Can you allow
I think
me?
Amy needs to make you the host to share your
Okay.
screen.
Thank you.
Amy, if you could make her the host, that'd be awesome.
So how do I do that?
Just go over to Kiana's name
Okay.
And then if you hover over that, it should come up with or you can pass it back to me. Pass it back to me. Go to my name, and then if you hover over it, should give you the option to make me the host.
Here it is. It's the little 3 dots.
Yep.
Got it. Okay.
Oh, I'm the host.
Yeah.
Woohoo! Thank you.
Okay, let's see. I'm going to start with the case testing report. Which screen are you guys seeing? I've got 2 screens here.
I have PCR test administered by the Ho-Chunk Nation Department of Health, March 17th to May 29th.
Awesome, thank you. So this is the COVID cases testing throughout the pandemic. And I'd like you to notice here that we had our highest amount in November, and then we got the vaccine in December. These are tests. Where's the positive? Number of positive is the orange. So it could have continued to go up and up. So what we are interpreting this as is that the vaccine is working because it stopped the increase in cases and is now decreasing. Again, I think this shows it a little bit nicer here and not so busy. This one says that we are getting most of our cases from our clinics, which makes sense because people who are not feeling well present to the clinic, and then our community testing is 12%. So a lot of this is people who do not have any symptoms. And then outside testing could be from other community sites or ERs or other clinics and hospitals. And we have a small percentage where we don't know where that is coming from. Most of our cases are female at 56%. And then we have 79% of our cases are tribal members. That can be from any tribe. And then 20% are non-tribal. And this is our age group who are most affected. So we have the 45 and 59-year-olds. And then recently, after we have been vaccinated, our 0 to 17-year-old numbers have started climbing because they have not been able to be vaccinated until most recently. And this is our confirmed positive cases by county. You can see Jackson is the highest, but that is also because they have the highest percent of our Ho-Chunk Nation population. And that's testing and positive cases. So I'm going to go on to the next report, which is our vaccine summary. So we have given over 14,000 doses of vaccine. Can you see this one okay? Screen sharing has stopped. I'm going to try this again.
Yep, we just see you.
How about now?
We can see it.
There it is. Yep, we can see it.
Okay. And is it okay or should I enlarge it?
Make it bigger.
Maybe a little. Yeah, make it bigger.
How's that?
We all have geriatric eyes.
Yeah, better.
Okay. So we've given over 14,000 vaccines for a total of over 7,000 individuals vaccinated. And the majority of those 7,000 people have completed their series. So this one says up to date. So that would mean that they are not overdue for their vaccine, whereas we have almost 600 people that are overdue. So again, this is just saying that in a chart. So we've got over 90% of our individuals who have received their vaccine have completed it. And then this is the vaccines that we received by month. Blue indicates first dose. green indicates second dose. So you'll notice here that we stopped receiving vaccines in May. We still have plenty of vaccines, but have not, the demand for vaccines has decreased. And this is the actual number of vaccines given. Again, green is first dose, blue is second dose. The majority of our tribal members who have received at least one dose of COVID-19 are elders at 60 and over. And then I think lagging behind, unsurprisingly, are our youth. And again, that's just because they did not have access to the vaccine early on. So 52% of individuals getting the vaccine are female, and 67% of everyone that we have vaccinated are tribal members. Age distribution, same thing. And here's the more interesting stuff. So within our 16 county service delivery area, we have vaccinated 46% of individuals. That's a loss of 3.7%. And that's only because we increased the age groups of who was eligible. So prior to this, it was 16, 17?
16.
Okay.
Yeah, 16.
16 and over. So then most recently it's now 12. So that's why it appears like we have gone down in the percent that we have vaccinated. Prior to that, we were about 50%. State of Wisconsin, Ho-Chunk tribal members are at 38% and nationally 28%. Our elders are doing excellent. Within the state of Wisconsin, we've got 66.5% of our elders that have been vaccinated. So that's exciting. And then nationally 50%. So here's just the graph of our vaccine uptake, and these black lines represent when the eligibility changed. So we opened it up to our youth. And this is on a map what locations or counties are getting vaccinated the most. So we have Jackson, Columbia, and Dane with the most. And then Crawford, Eau Claire, Wood, Shawano, right up here have the lowest uptake. All right, I'm going to go to the next one. Can you still see it?
Mm-hmm.
Yes.
Okay. Confirmed cases over time. So the red represents confirmed cases. The green are hospitalizations, and then blue are deaths. So you can see that our hospitalizations really peaked in November. And again, this is when we had 99 active cases at one time. So, and it's really leveling off nicely. That's what we want to see. And here's how many deaths per month that we had. Or I'm sorry, this is hospitalizations. So again, November, we had the 99 active cases, 22 of those were hospitalized, followed by 8 deaths in December and January, kind of higher, which is, I'm sorry, hospitalizations. Hospitalized cases. So the majority of our hospitalized age groups are within our elders, but we still have individuals hospitalized who are in the 0 to 17. So no age group is spared by COVID and having to be hospitalized. The majority of our hospitalized individuals are males, and 90% of them are tribal members. And these are the cases that are resulting in death. So as you can see, November, we had 1 death and then more in December, and that's unsurprising as well. Age distribution, the majority of them are elders at 60 plus, and then 38% 0.9% were in the 45 to 59 years old, and 5.6% of cases were 18 to 24. So we're still losing our youth. They're not immune to this disease and having serious complications and could potentially result in death. And our individuals who have passed away from this, 55% are male. So if you recall, males are getting tested less and vaccinated less, being hospitalized more and dying more. So I'm calling on all our men to come in, get their vaccine, be tested, and take care of yourselves because we need you. So 77% of our deaths have been Ho-Chunk tribal members. I'm sorry, tribal members in general. And then the remaining are split evenly between non-tribal members and unknown. And then at the bottom, 77% of the individuals who passed away from COVID were hospitalized prior to their death. And that's all our reports. Are there any questions from our reports? Or any comments from the rest of the panel?
I have a comment, Kiana. We got an email today saying there's a $20 gas voucher for if you come and get the vaccine, and that's for everybody, not just our 12-year-olds, 12 to 17-year-olds, but it's for everybody, correct?
Correct. This applies to people who are getting their vaccine now. So if you've already been vaccinated, you would not be eligible for the gas cards. Thank you for bringing that up, Amy.
Mm-hmm.
I guess I went through vaccine and testing data. One thing that people have been asking about are the long haulers. So people who don't completely recover. We don't currently have any data on this. However, we are working on beginning to collect data on that. Another question that I had from legislature today was, what % of our tribal population have been affected, have been hospitalized or tested positive or even passed away from this? So we don't have that data to share with you today, but we will work on getting that to you and your area reps. So the area reps are given these reports that I showed you on a weekly basis. So if you have questions, they would be able to answer some of those questions for you as well.
And I think it's important for people to remember that this data that we're getting isn't necessarily internal data. It's data that we're getting from our local partners, local counties. So we have to rely on that relationship with them to provide us some of this information. We also get information from community members, people that live far away that we may not have access to, their WEDS report, their Wisconsin Electronic Disease Surveillance Report. If they reach out and say, hey, my brother is hospitalized in Minneapolis, then we're able to reach out and provide more support to those people now that we know about it. So the data isn't 100% perfect because we have community members everywhere that we may not know about them testing positive for COVID or getting vaccinated, because if they're not getting vaccinated by us, we may not be able to gather that information. So just bear in mind that it's not 100% perfect, but it's the best that we're able to do with the information that we have.
Are there any questions? Comments? Concerns? We do have safer practices, personal protective equipment. If you or your family members are having some kind of event and you would like to have masks, hand sanitizer, or anything along those lines, please reach out to us and we can get that for you for your event.
Just
And
a couple of questions. I have just a couple of questions or thoughts that I know we've heard before around if, especially with children and adolescents who may have already had COVID, if it's still a good idea for them to be vaccinated, and then kind of what are the benefits of getting that particular group within the community vaccinated, and any benefits to the broader community.
I see those questions in the chat. Thank you, Pam. So as with adults, if you have a child age 12 or older, and they had COVID-19, it is still advisable for them to get the vaccination. Again, it's because that natural immunity that they get from having the infection, we don't know how much immunity they have or how long it lasts. So it's important to get that the vaccination. On top, it will not, and it'll just arm them even more than someone who did not have the COVID infection. And as far as effects on the community, children are, I'm going to call them vectors for spreading COVID-19. I think at one time, Kiana, you had shared with us that the adults that were getting COVID, they're like the common denominator was exposure to children. So again, children do get COVID-19, children do spread COVID-19, and children age 12 and over are now eligible for the vaccine to stop all of that. So, again, please immunize, or please get the vaccination for your child, for your entire family and our community. Did I answer your question?
Yeah, yep.
Okay.
And I would even say that our data supports what Amy said about children getting the COVID infection, because once the rest of the population had the opportunity to be vaccinated, but our youth did not, we saw cases increase in that population. So we know that the vaccine is working. We know that it's safe. I also had my son vaccinated. I have a little guy who's 10. Once the vaccine is offered to that age group, I will be getting him vaccinated as well.
And in case anyone hasn't heard, as we had been doing community testing in the past, crew would go up once a month to Wittenberg, Nakusa, Toma, Madison, and do testing. We're now moving forward, adding vaccinations to those events. So I believe it's every Tuesday. The team goes around in their little RV, like they're going camping, to offer COVID testing and vaccinations at our gaming sites. Pam is going to try to pull up that flyer so everyone knows what to watch for when they're going to be in your area, if technology works with her.
Ooh, the pressure's on. I'll keep working on it. Just chat amongst yourselves.
The $20 gift card is also available at the community events. So it's not just the clinic sites.
And I think it's fair to say, Kiana, correct me if I'm wrong, that if you have other ideas for incentives, I know other places in the state are giving away beer and cheese. So I think if there are other incentives that you think would be more incentivizing than guest cards, please let us know so we can use those.
I absolutely agree.
I think I have one other question that I know that we have kind of talked about, and this has come up, is kind of when community members are looking for good information about vaccines and kind of where they're looking, whether it's on the internet or from other resources, like what are maybe some of the tools or things that they should look for to know that this is good information, that it isn't some hoax or something. So good quality information. What should community members look for?
I think if they're getting it from Facebook, it's always questionable. So don't buy into things that people share on Facebook. So my first is definitely talk to your primary care person. If you can't, call them, see them, and talk to them about any concerns or questions you have about the vaccination. And then second would be websites like the CDC or Johns Hopkins. Those are my two favorite.
I like those two. And then I also will reference the World Health Organization.
Wisconsin Department of Human Services also for health services is really good too.
Yeah. So when we make recommendations or those kinds of things, these are the sites that we are going to and looking at their recommendations and taking them into consideration. So we don't just use one, we kind of go to multiple trusted sources and go from there.
I know one of the things that I put in the chat, just to let everyone know, is for the data pieces that Kiana went through. We do have a data dashboard that we update, and it's on the health department website. So if you go there, it's health.hochunk.com. There is a dashboard there. We will be continually looking at measures that we want to put up there that would help. And also it's important to know on that data dashboard too, that there might be some definitions or changes as we're collecting and moving through the pandemic. Things have changed, but to take a look at them. The other thing on the health department website is some of our videos from the virtual town halls, and then also some of the other videos that have been made and shared are also on that site, as well as other educational information about vaccines, about testing, about isolation and quarantine. So please feel free to go there and take a look at the resources that are available and share that as well.
There are still some places that continue to have masking. So like if you're traveling on mass transportation, airports, those kinds of things, you may need to be wearing your mask. Also hospitals, clinics, healthcare facilities, they also require masking. And then individual businesses can also set their own standards. Any luck with that flyer, Pam?
Yep, I just found it. I'm gonna pull it up.
So our target for July is to move the vaccines that are done at the clinic into, or at the clinic sites, to move actually into the clinic so that you would be able to make appointments for the clinic rather than the vaccine event itself. So that's our plan. Hopefully we'll get that going mid-summer.
I also want to add that if your child age 12 or older is due for a well child check and they're due for immunizations, that they can get their childhood immunizations at the same time they get the COVID vaccination. So, so I do want to make that point as well. So it's safe to be given at the same time with the other childhood immunizations. So don't hesitate to get your child in for their annual well visit.
Most of our services are open at both of our clinic sites, our medical services, dental and optical, behavioral health. So just call and make your appointment.
Can you guys see my screen?
Yeah.
Yep.
Okay, sorry. So this is our new strike team. And this has been posted in the paper, and we've kind of sent it out and put it on our website, on our Facebook page. So we have a mobile unit that's going to be able to come right out and provide both testing and vaccine. We started this in June here, and we have June and July dates set up for the next couple months.
I think the only change to this is that we're not limiting it to only tribal members and employees, that this event would be open to the public.
Okay.
Yeah, most of these are at our casino sites or C-stores, so that we would have, general public would have access as well. So no appointment needed, just show up.
That's awesome.
That's a pretty accurate depiction of what our RV looks like. So watch for it in your area.
We're there 10 to 2. Well, if there's no more questions or comments, I think we could wrap it up. Thank you, everyone, for attending.
Thanks for your time
Thank
and
you.
listening.
Thank you guys for providing the information and chatting with us and answering questions. Just want to remind everyone that this is being recorded, and we are going to share this out. So in case you missed it or you want to share it with anyone, we will be sending that out before the end of the day. So be looking for it. So thank you everyone for coming and providing questions. And we will hopefully see you or talk with you in the future. As more information comes out, we will plan more town halls. If you have questions, please feel free to send them in so that we have future topics as well, so we can address concerns. If not, thank you, everyone.
Thank you.
Thank you.